The Syrian military continued its strikes on the Damascus suburb of eastern Ghouta, a rebel-held area that's under siege by government forces. Last week, a carefully brokered evacuation agreement allowed for 29 critically ill residents, including children, to move to hospitals inside the capital. But hundreds more of the sick remain trapped, just part of a spiraling medical crisis playing out across Syria and in the neighboring countries where Syrian refugees are struggling to get the care they need.
Alaa is 10 years old and was born with a hole in his heart. The condition means that running around like any other kid can be seriously dangerous. The war in Syria left him without a father and meant he never received the treatment he desperately needed. He fled here to Jordan with his mother and sister in 2013 and now lives as an unregistered refugee. That means Alaa can't access Jordan's healthcare system, and the private alternative costs thousands of dollars that his family doesn't have. Charities and NGOs are doing their best to fill the gaps, and backlogs are agonizingly long.
ماما
وش تشعرين هسه؟
خايفة عليه بس احكي لك خايفة خايفة ابني وحيدي مالي غيره طلعت من الحرب مشان العون.
But after nearly 8 months, Alaa's mother Sehar finally got word that Alaa would be getting the surgery they'd been waiting for. In critical medical cases, refugees can be given treatment in Jordan's hospitals. But many of those, including Alaa, who need specialised care, can't get help. The British-born charity Chain of Hope supports a team of 7 medical volunteers from the US, led by Dr. Mark Turrentine, to travel to Jordan 4 times a year.
You could just stay over here and you'd never meet the needs of all the kids that are in the region. It gives you a different perspective of what it means to help people. This is kind of the old school medicine where you're in it for the reason of helping people. So if we have an opportunity to do it, you take that opportunity.
Dr. Turrentine has taken part in more than 20 missions like this one and treated more than 200 patients like Alaa. He works alongside local medics in a private hospital to treat children with heart defects for free, many of them Syrian refugees. How many children like Alaa will you be operating on in this mission?
Well, the working list I have right now, just assembled from August, has over 30 kids on it. Okay, ear clamped. Protamine, please. If you have a child in heart failure, it's very costly. It impacts the families in many ways, and that child most likely is not going to have anywhere close to a normal survival curve. And so there's a huge social cost as well as humanitarian one to the families for an unrepaired child. The post-repair shows that all 3 issues are gone and the heart function is good, so things went as planned.
The UN says that this year it needs more than $4 billion in total aid to help the 5.4 million registered Syrian refugees in neighbouring countries like Jordan. It's a small increase on their appeal for 2017, but they've only managed to raise about half of that.
شلونك؟
تمام
شلونك؟
الحمد لله.
شلونك؟ هاي فايف. منيح؟ أحسن؟
الحمد لله.
الحمد لله.